Good afternoon. Welcome, everyone. Today's speaker at Talk Evidence at AyurVAID, we have Dr. Rakesh Nair, who is the Senior Physician and Medical Superintendent in AyurVAID at Aster CMI, Hebal, Karnataka. Dr. Rakesh is an MD in Ayurveda Dravyaguna Vijnana from KVG Ayurveda Medical College, Bengaluru. He graduated with a degree of BMS from Indian Institute of Ayurvedic Medical College, Bengaluru. With a strong and robust clinical experience of more than 10 years, he has been efficiently managing various disease conditions in a very unique integrated care approach as the medical superintendent of AyurVAID at Aster CMI, Hebal, Karnataka. In the recent past, he efficiently led the team of AyurVAID hospitals in the management of COVID patients in COVID Care Center, C.V. Raman Nagar, and an appropriately integrated care model of Ayurveda and allopathy of Ayurveda hospitals, PCMS Restore Health, and Aster Labs. Today in Talk Evidence at AyurVAID, we are presenting a case of fibromyalgia managed by integrative approach. Fibromyalgia is common chronic syndrome that causes widespread body pain, fatigue, and cognitive issues, management of which requires a comprehensive approach as the cause is still unclear. With this note, I, Dr. Abhilash, welcome our respected colleague, Dr. Rakesh, onto the dais and to present his case and to shower his light on this subject. Welcome, Dr. Rakesh. Over to you.
Thank you. Thank you, Dr. Abhilash. So, good afternoon. So, today I am in front to present a unique case of fibromyalgia, also called as myofascial pain syndrome. So, there's a debate that both are same or different and things like that. But for us, Ayurveda physicians, we'll have to understand, are we diagnosing it properly? Number one. Second one, are we identifying it properly? Number two. Number three is, in our science, is there any references or any scattered points or scattered things told about fibromyalgia? If yes, what are the references? How can we directly manage? And what is the limitations being an Ayurveda doctor can be respect to fibromyalgia? Can I handle this disease condition single-handedly, or do I require a help of a multiple system approach? Is the discussion which I would like to take forward in this session. This particular case was diagnosed by my colleague in pain and palliative medicine and as fibromyalgia. Because of that reason, I came to know it was fibromyalgia. If it had come single-handedly to my clinic, I diagnose it? So coming to that point, pain. No one likes pain. That's the first thing. It would be a physical pain, mental pain. No one likes pain. Everybody wants a pain relief life or pain relief day. If pain comes, unlike allopathy or modern system of medicine, Ayurveda has a unique way of approaching pain. How can it be addressed? There are different various words or expressions or references to pain. It starts from Shula, Toda, Beda, different variations of pain. Is this all same? We also have a reference that pain may be because of Vata. Is it true? Is it only because of Vayu, or is it associated with other symptoms like Vata, Pitta, Kapha, Tridosha? Is it only related to single dhatus, or is it multiple dhatus which causes pain? This analysis makes us unique to understand pain and give a complex approach and complex treatment to treat this pain. With this introduction, I would want to introduce this case where a 40 or 48-year-old female was referred to Ayurveda OPD. She did not come to OPD, but she was referred by a pain and palliative department for the following complaints. It is pain. Pain is widespread. Widespread means throughout the body there was pain. VAS of 10 out of 10. Since 3 to 4 years. We have to imagine that since 3 to 4 years, she was suffering from pain and was on conservative management, but the pain is still not subsided. And since 10 days, it was unbearable. The widespread pain is on the regions of neck and shoulder. Sometimes it radiates to leg. There is no fixed pattern, but it transfers from neck, shoulder, and leg. Associated with that, she doesn't sleep. She gets lack of sleep. of high severity, insomnia severity index of 23 since 5 years, and also headache on and off of VAS scale 8 by 10. So this was a presentation when she had come to my OPD. When I did the diagnosis, starting with Astasthana Pariksha, we understood that the Nadi was Sarpagati and Lagu Akriti, which directs to Vata Pradhana. Jiva had Shweta and Upalepa, which led to Ama and Kapha. Rest all was normal. Akriti was Karshna and she was Stula, directing to Kapha and Vata predominance. Sri Arogya was all fine. She had excessive menstrual pain, which is again associated with Vata and Kapha association. Amongst the Dashavida Pariksha, the Roga Bala is Balavan because of high chronicity. Sattva is very, very poor. Avara. Agni is Tikshna. She can digest anything. Her appetite is absolutely fine. She has no acidity. She has no this one, but her Agni is absolutely high. Means after food, again after half an hour, she feels hungry. She can digest that food. So that Agni is very Tikshna. This was the status from the Dashavida Pariksha. Aturavastha, it is Jirna, and Rogavastha is clearly visible. It's Nivyakta. From the Rogi Bala point of view, Deha was Pravara, Agni is Pravara, but the Sattva is Avara. With this, I did a Srota Pariksha where I had two Vrikti Lakshanas. One was Anidrata and one was Vedana. So from this Anidrata, the Sthana is at Shiras, Hridaya and Manas. The Sthanika Samprapti says there is a Vata Prakopa. The Vata Prakopa is not because of Dhatu Kshaya, it is because of Srota Avarodha. There is increase in Chalaguna. There is difficulty in Vishaya Grahana, increase in Raja, Mana Klanta, absence of Mano Nivritti, and there is Anidrata. This is the Samprapti which I could derive from the history taken. The Guna associated is Ushna, Ruksha, and Chala. So with this, I could decipher that the dosha involved is Anila and Pitta Pradhana. Tarpaka Kapha, Sadhaka Pitta, and Pranavayu. So Tridoshas are involved. Rasa Rakta Dushyas. The Srotas involved is Prana, Anna, Rasavaha Srotas, and Manovaha Srotas with Vimarga Gamna and Ati Pravriti as its Dushti. With the respect to Vedana, it is typically Shiras, Griva, and Sarvanga. There is Ama Utpatti leading to Sama, increase in the Kleda, which leads to Srota Varoda, Vata Vriddhi. That increases Pitta. There is Dhatu Paka also happening. Rasa Dhatu lacks Prirana. Rakta Dhatu, where is Kshaya, leads to Mamsa Dhatu, Uttarotter Dhatus, and Mamsa Dhatu leading to Vedana. So Dushti Prakara is the Sangha and the Vimargamna. So these are the two Vikriti Lakshanas. These are the two Vikriti Lakshanas which I could decipher from the Shrota Pariksha. Now, the differential diagnosis which I could get into is, it could be Anidada as a single-handed, which is Vata Pitta Pradhana. Gulma, which is Kapha Pitta Pradhana. It could be Pakvashegata Vata. It could be Griva Graha. It could be Astigata Vata. It could be Vishada, or it could be Surya Varta or Ardhava Bedaka. These are the possible diagnoses with the presenting complaints. Or it could be insomnia, migraine headache, depression, and or cervical spondylitis. At this point of time, I would like to stop here with the differential diagnosis, because here there are two possibilities. If the patient comes single-handedly, our diagnosis would only come in between of this thing. But since it was already diagnosed and come, let us learn how different is from this differential diagnosis. So keeping this as an already diagnosed, which is fibromyalgia, we understand more of the muscles. Muscle, a skeletal muscle, which is the largest organ, is 50% occupying the whole body. Modern society, it is a major morbidity. It stands fourth after bones, joints, and nerves. It is the underdiagnosed and undertreated disease. Prevalence many. In orthopedic clinic, it comes to 21%. In lifetime prevalence, 32. In our OP, meaning muscle. There are different layers: superficial fascia and deep fascia. Superficial fascia stores fat and water, which is a loose connective tissue. Deep fascia, it sheaths all muscles. Muscle movements occurs because of this deep fascia. It makes the muscles glide. And in this, there is something called a subserous fascia, thoracic and abdominal cavities. It's between the thoracic and abdominal cavities. Internal organs, there's flexibility and movement, and dense connective tissue. we should know the basic anatomy of the facial layers, because without understanding the anatomy, we can't understand the diseases. This is how it is: the superficial fascia and then the deep fascia. This is how it sees in the top angle. That is, this superficial fascia is a white coating. Subserous fascia is that white coating. The yellow one is the superficial fascia, and then this pink color one is the deep fascia. These are the organs, these are the vessels. So this muscles has to glide amongst this bag. This is called as the facial bag, where you have the bone, central placed ostium or the bone, which is called as the periosteum. You have the superficial epimysium, that is the outermost layer, and you have the septal, which divides the mouth muscles. So this is hold on with a bag where the muscles has to move. This is very crucial, because if I see a muscle there, I do a cross section of a muscle, then you have multiple layers. That is, you have a fascicle which is wrapped by something called as perimysium. It's a connective tissue. It connects from one cell to another cell. And you have endomysium and a perimysium. Then the subtlest form of the tissue of the muscles is sarcolemma, which has capillaries in it. Why are we studying this? Is because this connective tissue disorders is one of the factor for fibromyalgia. There's something called as end plate transmission, where the nerve endings comes to the muscles. This is the muscle. So there is, when this occurs at this juncture, the nerve ending is there, and this is the muscle. There is a synaptic activity happening. This is a acetylcholine junction, or the synaptic cleft we call it as. The messages pass from the nerves, and then there is a chain of reactions happening between the nerves and the muscles, which is acetylcholinesterase, choline, and acetic acid. Any deviation in this chemical changes leads to what you call as inflammation. And a muscle will have something called as a taut band, which is a thickened band. And in that taut band, there is something called as a trigger point. This trigger point has something called as an end plate zone. So this is a knot-like structure. So what is MPS? A hyper irritable spot in the skeletal muscle that is associated with a hypersensitivity palpable nodule in a taut band. So this is a taut band. In the taut band, there is a hypersensitive palpable nodule. The spot is painful on manual compression and can give rise to characteristic referred pain, referred tenderness, motor dysfunction, and autonomic phenomena. What's a trigger point? A trigger points are small, explicitly tender areas which cause pain referred to a distant region called as the referred pain zone. It means to say trigger point can be somewhere and the pain can be elsewhere. Okay, this is very, very crucial for us to understand, because the pressure point may be at one point of time, and the pain which releases is on the different zone. They are activated. This referred pain zone or this trigger points are activated by pressure, movement, ergonomics, change of barometric pressure and tension, be it physical or emotional. These trigger points tend to manifest within the epimysium, that is in this area. Second thing is, there is also a neuroendocrine factor involved in this fibromyalgia. That is, when there is some stress, brain involvement, there is a chemical changes happening in the part which can lead to a change in the gut microbiota. This references is from the Harrison's principles of internal medications. Neuronal messages, endocrine message, and immune message, which from the brain leads to the change in the microbiota. There is a concept called as dysbiosis, which is newly formed in the modern system of medicine, wherein the gut-brain axis is also involved in the fibromyalgic conditions. So different conditions where fibromyalgia can be a symptom is IBS, functional GI disorders, post-infectious IBS, neuroimmune systems, autonomic nervous systems, anxiety, visceral pain, etc., etc. These are the homeostasis. So there are three factors which has to be kept in mind. One is the brain, or the nervous system, second is the muscle, and the third one is the gut. So these three has to be kept on the homeostasis to get the fibromyalgia into control. Trigger types are into two types. The trigger point is a point in the muscle, as I said earlier. Trigger types of two types, which is latent and active. The latent is stimulation on pressing the trigger point. You should not press the whole muscle. All muscle will have a particular trigger point. That particular trigger point, when stimulated, will be painful. There will be stiffness in that muscular area. Then there is a decreased range of movements. Active trigger points is painful without stimulus. Need not touch, but there'll be severe pain like this. This is a trapezius muscle. There'll be a localized spasm. So we Ayurveda doctors needs to differentiate between spasms and stiffness. Both are two different clinical conditions. Then there will be a palpable point, and there is or misdiagnose the conditions. Some people come to the complaint of toothache. There may be some caries present, but if this masseter muscles or the jaw muscles is triggered, the blue points is the triggering point. If this is triggered, then they'll have pain in the ear, they'll have pain in the jaws, they'll have even headache. Similarly, the temporalis muscles, if it is triggered, then they'll have referred pain to the teeth, to the jaws, to the back of the head. Similarly, sternocleidoid mastoid muscles, this is the usual tendency where the people, any headache comes, they this directly negate it to or equate it to migrainal headaches. It can be migraine, but it is we physicians who should be telling that migraine symptoms are like this. It could be even the trigger point of the sternocleidomastoid muscles. That is, when any trigger of this neck muscles occurs, there is a pain radiating towards the eyebrows, back of the head, the jaws, etc. So the differential diagnosis should be with the muscular pain as well as this. Heart attack or radiating pain to the hand. The moment we get the radiating pain, we may say it is cervical spondylitis. We jump into conclusion. No, it could also be a trigger point of your scalene muscles, which is just below your neck, which has radiating pain towards your hand. External oblique, that is the chest muscles. They may have radiating pain to the central abdomen, lower abdomen, near to the umbilicus. Diaphragm, typical chest pain, typical cardiac pain. It could be also the trigger point of your central tendons of your diaphragm, which can also cause the pain in the chest area. This is a commonest thing we overcome. That is pain radiating from the buttocks till the leg. The moment it comes, if we have an MRI, then okay. Otherwise, how do we differentiate it between a gluteal muscle trigger point versus the sciatica or versus any other complaints? So the idea is that if the gluteal muscles, the trigger points are triggered, that is just above the hip area, then you have a radiating pain which is from the buttocks radiating till backwards. Dermatomes are another criteria which we can differentiate between the gluteal areas as well as the sciatica. Adductor longus muscles will have radiating pain till the leg. Final other commonest area is the heel pain. The moment heel pain comes, we say it's vata kantaka or calcaneal spur, but it could also be a calf muscle. It could also be a calf muscle trigger, which can radiate till the heel. So how do we identify a trigger point? So one of the paper released in the musculoskeletal section says that one, we have to identify the taut band of a particular muscle. Second, identify the hypersensitive spot and understand what is the pain, referred pain of that particular muscle. So each muscles has a unique character of a referred pain. That referred pain, if we know, we should know which all the areas it covers. Clinically examine the taut band as well as the hypersensitive spot. It can be an individual diseases or it can be identified with different other diseases. Like for example, low back ache, like radiculopathies, like tendonitis, like migraines, like tension type headaches, like carpal tunnel syndrome. So it can be a combination of problems, or it could be an individual problems, or it could be this problems also. So it's we physicians will have to differentiate between, is it myofascial pain syndrome, fibromyalgia, or is it associated with any of the other pains. How do we do that? First starts with the history. We should understand the pain pattern. How do you understand the pain pattern? When is the onset? Is it acute or chronic? What is the sex or age? Any group. I'm talking with respect to the fibromyalgia. In fibromyalgia, it can occur in any group. Is it localized or generalized? In localized, there will be a poorly pain. If it is referred, what is the pattern of the referred pain? Worse, on activity, it worsens, and it is associated with heavy other problems. Work nature, posture, exercise. In this case, work nature is only household work, posture is very bad, and exercise is also poor. Posture plays a major role. Range of movements, limbs and spine. We'll have to clinically examine the limbs and spine. Movements, subluxations, muscle power, soft tissue palpation, the referred pain, local twitch response, and pain-related local muscle weakness. The tonicity of the muscle strength, the muscle weakness, which is pain-related, needs to be examined. So how do we palpate? This is the factor, or this figure says the intensity of the pressure. That is, in trapezius muscle, it has to be palpated depth. In biceps, it has to be palpated with a minimal pressure. So as we go up the order, the pressure will be lesser. That is, from trapezius to quadratus, sternocleidoid, subscapularis, gluteus, scalene, piriformis, infraspinatus, and biceps. This is the way we palpate. That is, we use the middle finger and the ring finger and see the referred point. This arrow mark suggests that that is the tender point. If the tender point is switching towards the right, we use the middle finger and then slowly palpate to the index finger. And if it is towards the left, then we slowly start with the index finger, come with the middle finger. So the tender point, if this is the tender spot, the second figure, if this is the tender spot, then there is a referred pain area towards the clockwise direction. The muscles origin and insertion should be known. From the origin and insertion, the referred pain area will be to the opposite direction. The taut band also is identified clinically with the band of muscles, thickened band of muscles. And when you run with the muscles, you get a knot, which is the trigger point knot. So how do we differentiate between MPS, myofascial syndrome, and fibromyalgia? In case of fibromyalgia, it's a widespread pain, whereas it is muscular pain in case of myofascial syndrome. There is decreased range of movements in myofascial. In fibromyalgia, there is no movement, these problems. Postural stresses, that is, at any point of time, it triggers. Trigger points are on muscles. The fibromyalgias are tender points. We can't even touch that point. There is referred patterns of pain in myofascial syndrome. In fibromyalgia, there is none. It is identified with poor sleep. MPS has a tight band of muscle, stiffness. Fibromyalgia has fatigue. So with this background, we were given to see that the team of palliative medicine, psychologist, and Ayurveda takes up this fibromyalgia. So we had a discussion, and then we said that this patient has to sleep because to calm down the nerve system, because she's on multiple NSAIDs. Psychologists are training their mind, but still the pain is not coming down. So we were told that she has to sleep. So with that anidrata also, we could understand that we could decipher the Samprapti with rasa, rakta, and mamsa, where the lakshanas which is told is actually deciphering with her symptoms, which is toda, adyan, guru anga, and stabda. So mamsa dhatu is involved. That is, mamsa avarana vatas lakshanas is seen, which we came to a conclusion that it has symptoms correlating to fibromyalgia symptoms, actually reciprocating the symptoms of fibromyalgia. So we have come to a conclusion that it could be Mamsagata Vata associated with Anidrata. So this was a course in the hospital. 15th of March 2021, patient was referred from pain and palliative care for Ayurveda consultation. 24th February, the patient was admitted under Ayurveda department for co-managed care. 25th February, supportive care was obtained from pain and palliative care and Dr. Vaishnavi for psychological assessment. 25th to 5th of March, we did parallel interventions with Ayurveda therapists, psychology, relaxation exercises, ahara, diet modifications, and our internal medications. Overall, monitored by the pain and palliative doctor. 5th of March, she was doing good and was continuing the same progress post discharge. Sleep improved to 6 to 7 hours. Exactly on 8th of March, exactly after a year, we had a follow-up call to ask how is she. She's still now having absolutely no issues, no pain. She's having good sleep, she feels the body is light. There is good energy levels and absolutely no medications. Only our external applications is being continued. So with this, what is the Chikitsa Siddhanta for Anidrata? It is typically Vata Pitta Haram, Madhurasa Prayogam, Guru Guna Aushadha Prayogam, and Mrudu Rechana for Pitta Nimittajam. Mamsagata Vata, the Lakshanas, the treatment tells is Sweda Abhyangani Shastani, Hridyam Cha Annam Tvag Ashrite. He stresses main on to eat what food we like, means what the food patient likes to be given. This is the typical treatment given for Mamsagata Vata. I still remember that she likes ragi mudde very nicely, which she wants to have it. Though it can cause some kleda or abhishandi, we had given this ragi mudde only for her during our course of stay, just to follow the fact that how apt is this Hridyam Charnam. So she was happy. The whole we were this line of treatment told for Mamsagata Vata. So we did the same thing, removed the Kledatvam by doing Udvartanam, altered with Abhyangam, did a Shamana Snehapana with the Virechana, then Takadara, Shiropichu, Shiroabhyangam, and Nasyam. So the outcome scales. The outcome scales from the sleep, which was very poor, by 5th March, she started sleeping, which is still continuing. Then Tikshna Agni has come to Samagni. Rest parameters were all good. The height, weight, which was 76, has come to only 1 kilo. She is now increased to 76, the same kilo, same. But the other parameters such as headache, ISI, COOS, everything is now under control. Here, I would want to highlight another fact that the outcome scales is it very much important. It's very important for us because how do I know that the sustainability of the patient is still existing while discharge? So there should be some checklist like of thing to see whether the patient is discharged, whether it's in good condition. Acharya Charaka in his Vimanasthana says about Dhatu Samyam. Karyam Dhatu Samyam Tasya Lakshanam Vikaropashamam Pariksha Twasya. How do I see that the Dhatu Samya has occurred? Ruk Upashamanam. That is from the outcome scale, point number 16, 17, 18, 19, 20. Ruk Upashamanam. Swara Varna Yogoho. Shariropachayaha. Bala Vriddhi. Abhyavaharya Abhilashaha. That is the maintenance of Agni. Ruchir Ahara Kale. She gets the taste to eat. Abhyavarhatasya Chahaharasya Kale Samyak Jaranam. Whether the Amatvam formation is happening, whether the previous food is digested. Nidra Labo Yatha Kalam. Point number 1. Sleep. Vaikarinam cha swapnanam darshanam. That is the dreams. Whether she remembers the dreams, she doesn't remember the dreams. Dreams plays a major important role in this part. Sukhena cha pratibodhanam. Vata mutra purisha retasam muktihi. Sarvakarai manor buddhi indriyanam cha vyapit aditihi. So I get a checklist stating that amongst this may not be for everything, but disease wise checklist is there. One of the checklist is Vata Pitta Kapha. list whether all these things is perfect or it is. The assessment of this is equivalent in our outcome scale, the tracking outcome scale. So in this case also we see that what is being balanced for a year of it for make us like help tasmat bahushrutah shastram vijaniyat chikitsakaha. So this I see that there is no harm. I should not say that only Ayurveda can cure, but in this case I see a particular model where all system of medicine has done the things and the patient is still benefited and then got the best of the benefit, and sustainability is also there. So this is how we deciphered the treatment protocol for not treatment protocol but treatment line for the fibromyalgias. So with this I would like to conclude how did I come to a diagnosis and the treatment for fibromyalgia. Thank you one and all.
So if any of the panel members have any questions, kindly you can ask at the moment.
Okay, let me jump in. First of all, Dr. Rakesh, a mind-blowing presentation. Let me compliment you on the strong points in the presentation. I hope you can hear me. Am I audible? Dr. Rakesh?
Yes, sir.
You can hear me?
Yes, sir. Yes, sir. Yes, sir.
So I guess a couple of centers due to some workload that I think Dr. Bhatt has got a program right at this time, another talk he's into. So that is why he's not, I think the Vedanta team is totally absent today. Similarly, Domlur, I think they have some excessive thing. But notwithstanding that, I'm sure they'll all benefit from seeing the video of this particular talk. So the couple of comments which I just want to bring in. I really appreciate the fact that you brought in the differential diagnosis, the modern medicine perspective. But from an integrative approach, it will be good to understand how during the progress of there was a initial period in February to March 2021. Then there was a period subsequent to that. So how did the medication actually go? What were the interventions, right? That's where this integrative view becomes very easy to understand that at the start of treatment, which are the medicines going or treatments, then how does things progress? And then 1 year later, right? So even the patient's outcome scale, we don't know 1 year later on the same points. Dr. Rakesh, can you hear me?
Yes, sir. Yes, sir.
Okay, because suddenly it looks like it's frozen.
Yes, sir.
So one part is that to really get the purpose of the benefit of an integrative approach, we need to see how each system is intervening at different points. Otherwise, you don't know at the end of the day what really contributed, right? Although you're telling there is Dhatu Samyam, there are other things happening, but so this is one part.
Irrespective of yes.
Yeah, go ahead. Yeah, please go ahead.
Sorry. Sir, irrespective of any system of medicine, the whole system of medicine's approach, according to me, should be to achieve Dhatu Samyam, which was not possible at the initial stages. That is why it was referred to an Ayurveda department. Now, when we had an assessment, we understood that her Nidra was not nice, I mean, not up to the mark, her Manobala was not good, and then her Agni was was dearranged. First, from our Ayurveda parameters. At initial stages, she was on some neuro medicine, which is to calm her mind. Only single medicine prescribed from the pain and palliative. She was also prescribed general anxiety medicine, but she did not take for that part. It was at that juncture that, with that medication, she was transferred to Ayurveda. We started initially with external therapies, Lagu treatments and external therapies, and slowly started correcting the Agnis.
I got the point. I think you mentioned that. My larger point was that in establishing during an integrative approach that how both systems are going in parallel, sometimes they will be stopping, sometimes we'll be stopping, and then how is it that it worked? So there is a lot of clarity in terms of the role of physiatry, the role of the other department with whom you worked, right? So the coming together was quite nice. The other point I just wanted to bring was the medical history is not just about you brought in the history of this particular problem, but even the nidanas, if anything, which really happened at that point. And secondly, the comorbidities at the time was not completely evident. Why I'm bringing this up because in that Roga Samprapti, there is a, you made a very detailed analysis in the beginning and then led to a summary chart. So in the summary chart, apart from the core symptoms which are shown now, the relating to the fibromyalgia, if any other comorbidities are there, and what led to this whole thing, right, would have been adding further value, is my, for your comment.
Yeah, so I did not mention that in the slide, but this patient had absolutely no problem. Her, in fact, she was little stowly also, but her cholesterol levels was normal. She's not diabetic. She's not hypertensive. Absolutely no issues with that. Only thing is she had some psychological issues, some issues at home.
So what is
from
that?
The
What is the
point
cause
of
in your view, doctor? In which case, what really led to this thing? Is it, if you can go back to the Samprapti chart again, even your summary, not the diagram, there was another slide which had the Sampraptis. It'll be very, you've done a full analysis of the Pariksha. So to make these conclusions, this is a major set of conclusions. So how have we arrived at these conclusions? From history, from Pariksha? So
yeah, I'll explain in terms of first the Vikriti Lakshana, which is Anidrata.
Is that the only
from Anidra?
Is that the only Vikriti Lakshana?
No, our objective was the whole purpose for referring was that for Anidrata, not for Vedana. Vedana is a added understanding for me to understand the disease. But the reason for reference from that other department was to make her sleeplessness. That's it. So Anidrata is because of Vata Prakopa. Sharirika dosha Vikriti is influencing the manas, is the Samprapti which I'm trying to highlight. The reason for Vata Prakopa is the Vedana, which is in the next part where Vedana is coming. So it is interlinked. This is interlinked with the Vedana, is what I'm trying to tell, that how is Vata increasing? Vata is increasing because of her Ratri Jagarana. There is a Nidana of Ratri Jagarana and then her Aharas, etc. Which, okay, I'm sorry that I not mentioned that. But ultimately identifying the Nidanas is making her Vata Prakopa, which is causing Anidrita with this
So
Samprapti.
the Sthanika Samprapti you mentioned here is a classical Samprapti for Anidrita?
Yes. Yes, sir.
Right? Okay.
Yes, sir.
So, okay.
Yeah. Now, why is Vata Prakopa, Sharirika Vata Prakopa occurring? It is because of this Vedana Sthanika Samprapti, where there is Ama Utpatti, Sama formation, Srota Vrodha, Vata Vriddhi is occurring. There is Dhatu Paka amongst all the Dhatus. Because of this, there is Vata Vriddhi.
But the Agni and Ama, Dosha, Anilam, Pitta Pradhana. So it's not very, could you just go into the
Sir,
Agni and Amam?
Yes, sir. So, though there is a Dvandaja dosha of Vata and Pitta involvement, in this case, it is more of Pitta Pradhana. Though three doshas are involved, Kapha, Pitta and Vayu, though three doshas are involved, it is more of Pitta involvement, because Pitta increased will cause Anidrata. It is causing Anidrata. There is a support of Vayu as well as there is a share of Kapha also happening, no doubt on that. But it is mainly Pitta Pradhana because there is an absence in Vishaya Grahana, which we can see in her case. Vishaya Grahana, when I tell her, she immediately understands, but she immediately forgets. She's not focused, she's not concentrating. So that Vishaya Grahana is leading to Raja increasement. So this Raja is increasing because the symptoms is seen from the patient, which suggests that the Pitta is increased.
Yes.
Now, when that has occurred, then it is mainly Pitta Shamana. Of course, Vata also needs to be kept in mind. Vata, Pitta, Vata, Pradhana, it has to be controlled. But it is Pitta Shamana first and then controlling the Vayu. So the involvement of Sudosha is mainly Tarpaka Kapha, Sadhaka Pitta and Prana Vayu. Okay. This is the Manasika level which it increases, and this is the Sharirika changes which is happening. Though they were handling this, we try to tweak it with our internal medicines by just doing Ama Pachana and Srota Shuddhi with a simple Virechana. That led for the Vedana to come down when this also starts to reduce. This is the...
What were the Sama Lakshanas you saw? You have come to a conclusion, but it is not mentioned what was the Sama Lakshanas you saw, right?
Yes, sir.
So you said everything was okay.
Jiva had Shweta and
Okay.
Upalepa. From the Ashtasthana
Okay.
Pariksha, Jiva had
Okay.
Akriti, Staulya, and Sattva, which is Avara.
Mm-hmm. Okay.
So Sama Lakshanas is with this. And there was Stamba.
Yes.
Symptoms also says that Sama Lakshanas there. There is Stamba, there is Gaurava, there is Vedana.
Okay. The Sattva being Avara leading to Vata, right? Or is it Rajas and Tamas? What should you take? How do you go to Vata alone,
Sir,
singularly?
if there is a singular for Avara Sattva is Pittam Pangu, Kafam Pangu, Pangavo Maladatuvaha, Vayuna Yatra Niyante, Tatra Gachati Begavataha. Pitta and Kapha are stable. They don't have anything to move unless it is propelled by Vayu. So similarly, the same thing with the mind, where both Pitta and Kapha will be stagnated until and unless there is a Vata propellant happening there. So if there is a mind involvement happening, which is Savara Sattva, it is predominantly dominated by Vata. There can be an association of Pitta or Kapha also, but the root or the factor or the thing will be the Vayu.
Okay. I'll pause my comments at this point. We'll come back later. Thank you very much, Dr. Rakesh, for your clarification. We'll just wait for other.
Dr. Rakesh, I have an added question to this. Like you mentioned various types of interventions, like there was a intervention from the pain and palliative department, from Ayurveda, from psychology. You also mentioned about diet modifications, etc. So at which point of this Samprapti Vikatana, or this which point of or at which stage of the disease of this patient it was decided that these interventions should be there, or all the interventions were done together? That is one.
Okay.
And the second part of the question is that what were the dietary modifications, because you mentioned that.
Right. So since this was the one of the few cases where it was like to understand our whole departments more better. So there were multiple permutations and combinations which we were doing. So one of the combinations we did was that parallel interventions of all the three would be going on. That is, with the pain and palliative, which just was internal medications, number one, psychological interventions parallelly, and our internal medicines and external therapies also was going on. So answering to you, Dr. Abhilash, the thing was that parallel interventions in a day was going on for them. Number one. Number two is from the diet modifications. Since the patient was admitted into the Ayurveda department, we followed Mamsagata Vata Lakshanas, where that clearly says Hridyam cha Annam Tvak Ashrite. So we were convinced that this could be Mamsagata Vata things. So what food was pleasing to her, provided it doesn't increase kleda, her Agni was Tikshna. We have to also think that if you give Lagu Anna, then the Tikshna Agni will become more. So we have to reduce that Agni also. In the meanwhile, the Anna should be Hridyam, not likened by her. Means she's from typical Karnataka family. So that Karnataka type of food has to be followed, number two. And number three is that it should also do some Pachana effect. So with this, keeping these objectives in mind, we had planned a diet chart and then had given to our dietetics department, and then they had served us the food accordingly, in which one of the food was that ragi mudda, one time was our kanji, that our kanji was there, and another food was like rice anna rasam. Those were the diet modifications. Modifying that, we added some of the herbs like dashamulam yavagu, and shunti danyaga jalam, and like that some modifications was done so that it doesn't become more tikshna, but we are checking that pachana is also happening properly. This was the diet modifications. Hope I have answered the two, Dr. Abhilash.
Yeah. Yes, Dr. Rakesh. Yeah.
Good afternoon, doctor.
Hello, madam. Good afternoon.
Doctor, you have said Madhurasa Pradhana Prayoga and Guru Guna Pradhana Aushadas. This will again aggravate ama, no?
Correct. So that was for our, so Madhurasa Prayogam was administered. Madhurasa Prayogam was administered once the Ama Pachana is done. So we had initially given Tikta Rasa Pradhana Dravyas initially, so that there is Pachana happening. We didn't give Katu because of a Tikshna Agni. We want the Pachana to occur. So we selected Guluchadi, I think. Then Tikta Rasa Pradhana, of course, Tikta Rasa Pradhana only was initiated. Once that was done, to see that the vata aggravation is not happening, we did Tikta Shira. Tikta Shira, which is Madura. That is Gudichadi Shira. Tikta Shira. Tikta Shira Prayogam. So there is no Madura Tara also. Madura is controlled, whereas Tikta is also happening. That was initiated on the third line. I have done the points which is Madura as per the Shastra, but since live Pachana should occur, we started with Tikta and then went on to Madura, not proper Madura. We did Tikta with combination with Shira.
Okay, thanks.
Thank you.
Thank you, Dr. Rakesh, for such an educative section. So I think in many cases of fibromyalgia, in the earlier stages, doctors always advise them to do good exercises. And what I notice is that when they do vigorous exercises, it always lead to an increase in the vata dosha, or the vata prakopa will be more in them. And in many cases of fibromyalgia, we can see that when we correct the ama and the apical changes in the patient will be responding well to whatever treatments we are or whatever lifestyle modifications we are suggesting to them. And in that, diet also plays a major important factor. So always I feel that when dealing with fibromyalgia patient, our baseline correction of the ama and the apni, and that is where the Madhura Rasa or the food that we give also plays an important role. When we ask them to take light food, normally doctors sometimes prescribe light food for them. And in the light food, they will be switching more to salads and everything. So that always triggers their pain. But I have seen that when we advise them to take our kanji with Madhura Amla Lavana Rasa, it always helps to have a baseline correction of their symptoms also. So I think all fibromyalgia patients, when approached from that baseline correction level, patients respond more to treatments. Even without many of the body treatments, we will be able to tackle them.
Right. Correct. The point which I wanted to highlight here at this point of time is there are two conditions when a fibromyalgia approaches. One could be an acute condition of pain, and another will be the chronic condition of pain, which means they are in between the episode duration of the pain. They would have finished their acute condition, and then chronicity is there, but acute episode is over, and then they have come. This management is on the acute state, not on the chronic state. The patient is having severe pain on the acute stage. First reason is that it requires both, because standalone in this acute state can we manage all these three together, because psychological involvement is also very much important. There is an endocrine system, neuroendocrine system also, which is important. There is a muscular inflammation is also which is also very important. So we should be equipped in tackling these three. Number one is the baseline is, first of all, it is underdiagnosed. We cannot diagnose it. It comes as a chance because we diagnose it something else. That's the first thing. If we diagnose it also in acute state, can we manage this three? In a chronic stage, we can definitely manage. As you rightly said, with ahara and things like that, we can definitely manage. No doubt on that. But in acute state, is it possible? Because the patient has severe pain. He just wants some pain relief. That's it. He wants to be relief from the pain. So at that point of time, some external thing, this one in intervention is also required. So that is where this integrative part, plays a major role, especially in acute cases. where they are restless. It's a cycle. They don't sleep. Vata aggravates, pain aggravates. Because of the pain, again the sleep aggravates. Sleep doesn't come. Sleep doesn't come. Pain aggravates. So it's a cycle where they are in that vicious cycle. That cycle to be broken, somewhere it has to be opened up. That opening up is from us, which we can, as rightly said, the hara can be an opening for us, so that it can be like settling slowly.
Dr. Rakesh, it was really a very good presentation. Thanks to you.
Thank you, sir.
See, in the morning, I had written in the AyurVAID, I had written actually that Vikara Rama Kushulo Najiriya Kachana. We don't actually, yes, many in the modern medical science, some of the other diagnoses has been actually, made, but it was not properly given as. For example, if we say that Madhumeha, if we say diabetes, because it is directly correlates. Some of these diagnoses like fibromyalgia, we may not be able to exactly give the this one, no problem at all, but we have to understand. That's why Charaka has told this is the broad understanding of the Ayurveda. So Vaidya can actually understand by the dosha, dushya, samurchana, and all these things. He can decide his own way and understand. So fibromyalgia, we have learned actually in Gujarat Ayurveda University, is actually to be taken as a mamsa avrata vata, and mamsa vata is different from the mamsa avrata vata. Mamsa gata vata, many people take it as so muscular dystrophy. Mamsa gata vata, genetic disease, but mamsa avrata vata may be mostly compared to fibromyalgia, what I feel. Because the Samprapti, when the ama is produced, because of the this one Agni is very less, ama is produced. When this ama is mixed with the initiated vata dosha, it actually goes all over the body, and also a little bit of pitta is involved in this one. And when it is circulating, then it actually goes to the mamsa vahashrotas. It is obstructing the mamsa vahashrotas and obstructing the flow of the vata dosha. Vata dosha is actually, embedded in the mamsa. With that, what happens? It is causing so much of pain. Burning sensation is very less, but pain will be very much too much. So we take it as mamsa avrata vata. Initially, we give dhanyaka and guduchi as amapachana. Dhanyaka is a very mild spice which actually improves this one, and guduchi also is given. For some time, we give, this is my feeling, what I am telling. Whatever you have told till now, you have analyzed it thoroughly, and then, integrated approach you have told, wonderful. My view is actually we have to do the basti karma, which is very, very important after doing the amapachana. So for about 4 to 5 days, irrespective of whatever condition the patient comes, we have large number of patients of fibromyalgia. So many patients are suffering, but they may not be knowing actually how to differentiate in the vata and this one. Muscular pain is different, and the joint pains are different, bone pains are different actually. So here the muscles are more involved than the bones or joints actually. So in this way, so initially we do this one, amapachana with the dhanyaka and also guduchi. Of course, if it is really more of kapha dosha involvement, we give it, but usually it is not there. And the medicine which we usually give in our most of the. So we understand, by Shroto Rodha, Balabramsha, person always feels very, very, weak, tired. Tiredness is there. In the morning itself, he is tired. He doesn't get, fresh. Balabramsha, whole body is having, too much of heaviness. And pain, always pain in the muscles, and also so main pain is actually in the this one griva area at the cervical as well upper back. Usually patients they complain, but patients may complain pain anywhere, and it may last even few months to few years. Patients will be coming, and then they always have, and we have many number of the foreign patients who are suffering from these things. So in such condition, we give very simple medicine, ashwagandha.
Okay. While Dr. Bhatt comes, I have just one quick question. You talked about difference between spasm and stiffness. Could you just quickly tell what is the difference, Dr. Rakesh?
Yes, sir. So in a muscle, if in the taut band, so we have to identify a taut band. In a muscle, there is something called a taut band, which is the point near to the trigger point. The centimeters around the trigger point is the taut band. If the taut band tenderness is there, if there is stiffness, if the muscles are tight in the taut band, then that is stiffness. Usually what happens is when we say the muscles are stiff, it is the extensional muscles or the end muscles, which is the upper and the lower muscles, which is stiff. The center part may be very softer. That is not stiffness, that is spasms. If the central taut band is stiff or tight, hardened, then that is stiffness. Neurological part will have stiffness. Yes. Neurological dysfunctions will have stiffness. If you see that, if you just run down the muscles, that taut bands will be very stiff. That is stiffness. And there will be spasms also. So spasms and stiffness. So in Ayurveda, it is told as sphurana and toda. Sphurana is like spasms, and toda is the stiffness.
Stiffness.
I mean, that kind of pain coming out of that. Yes,
thank you. Appreciate it. Dr. Bhatt, you were interrupted. I think your connection went. Please complete, Dr. Bhatt. You were speaking earlier when your connection went. You can complete, please.
Yes, sir. Yes, sir. So there's a very simple treatment, though, even though we get too many patients of fibromyalgia. Very simple thing is actually initially for about 4 or 5 days, we do the Amapachana, and also we give the Ashwagandha, Gugulu, and also Brahmi, because it is actually this particular for fibromyalgia, invariably it is actually the psychosomatic disease. So psychological factors are very, very important. Rajas and tamas, mostly they are involved. Rajas is mostly involved in all such conditions. We do, Shirodhara, and also Basti treatment is very, very important treatment in such condition. So Basti, we have given, a few cases earlier, before coming here, we had given about Kalabasti also we had given in some cases because it's a very prolonged disease. So Yoga Basti, invariably we give it to almost all this one. And even after seeing the results in Ayurvedic, this one patient, allopathic doctors also used to refer some of the cases to this one. So it's a wonderful research we can actually do, and we can do a lot of work on this particular thing. In my opinion, Mamsavrata Vata can be taken as fibromyalgia, and Mamsa Gata Vata can be taken as the muscular dystrophy, what I feel like this. And a wonderful presentation, Dr. Rakesh. We can discuss more about this particular thing further.
Yes, sir.
Thank you very much.
I have a clarification. Sir. If in Charaka Chikitsa, when it is told as Avarana, he clearly says the synonym of Avarana is Gati, Gatha, Anyonya, Avarana, Avrata. These are all the synonyms. Based on the conditions, they say it is Gatavata. Sometimes it says Avaranavata. But according to me, I feel that Gati, Avarana, or Gatavata all is telling it is Avarana.
I understand. See, Vata can cause tremors. Vata can also, Vata is doing it. Same Vata is doing Vata increase in the Chalaguna, decrease in the Chalaguna. Both are actually taking place by Vata itself. So in such condition, Mamsa Gata Vata and Mamsa Avrata Vata, my feeling is, may not be similar, but there may be some difference between these two. Mamsa Avrata Vata can be taken, pain. In Avrata, pain will be there. In Gata, there will be loss of muscle function.
Just a question to you. You began with a slide in the initial thing to tell. This could have been cervical spondylosis. This could have been hundreds of things, right? So depending on which doctor that patient had gone to in Ayurveda, he could have tackled him from any angle, possibly, right? So the question that comes was, what is the probability that anybody would have actually taken one of the other diagnoses, and what would have been the problems coming from a misplaced diagnosis? So instead of looking at it as this, Mamsa Gata Vata or Mamsa Avrita Vata, if you had gone at it as a simple cervical spondylosis, what would have, or spondylitis?
Correct,
For
sir.
example, the pain was not all over the body. The pain was only in one part, right? So you could have easily confused for cervical issue, right? So, and the same thing would have happened, for example, in that, from buttocks, there is some radiating pain, and that could have been mistaken for sciatica. You told that point also.
Correct.
Right? So, how common is this happening? Dr. Bhatt, your comments will also be welcome. How commonly do we find these different presentations where we mix up between the actual etiologies?
After knowing this, sir, I will start with this. After knowing this, I started understanding about more of the muscle part, because muscle is one area which the physicians don't see. We usually see the bones, nerves, and muscles is one commonest area we don't see at all. Post this understanding and more understanding with the pain and palliative doctor and things like that, so he said examination is the key. For example, everybody says I get headache, frontal headache, backache, things like that. We take the history in our daily history and then say that, okay, he has acidity, he can also get the headache and things like that. So in the common practice, the diagnosis is almost going to the direction of migraine type. It's going to the migraine type, acidity, whatever the translation in our Ayurveda is, like Gulma, Surya Vartata, whatever it goes, because he's complained of headache, throbbing type of headache, half headache, these things like that. One thing we miss here is this temporosclenocladiate muscles trigger point. So during the practice, clinical examination plays a major role in this. As I said, once we start doing that trigger point palpation, if the trigger point palpation is faster or it is there, plus his ergonomics, his posture, does he use mobile at night, his Vayaktika Vritanta, that plus this, all those things can lead that, first our thing will be with the muscle part. Similarly, the muscle anatomy has to be known by us to see that which muscle has referred pain. For example, the referred pain of the sternocleidomastoid muscle will also give half headache, will also give a pain here.
Yeah, got the point. So my point was that if you're diagnosed it as Surya Varta and then treated for that, would it have triggered some other issue is the question.
Now that is where the luck of us is. Yeah, that's if there is association of kapha or pitta, both in this, which is Surya Varta is also there, this also is there. By default, kapha pitta is being treated, it can come down. But if the dosha balances is different, I consult and say that my dosha is this. I suppose I analyze and say this vata dosha is high, and I treating vata, given snehana or something like that, I give treat, but his kapha is there, then it will go for an adverse reaction. His pain will not come down, his pain will trigger.
So just quick follow-up question. Yeah, yes, Dr. Bhatt, please.
Yeah, see, the cervical spondylosis is connected to the bone as well as nerve, and the muscle pain is restricted to one particular part, or it may be radiating. So we will have to actually differentiate between the Mamsa Vata or fibromyalgia, also the cervical spondylosis.
Got it. So Dr. Indu, one connected point here, I think Dr. Bhatt's connection is giving trouble. Dr. Indu, your primary point about whenever we treat for Ama and Agni, you see patients with fibromyalgia improving, So the question that comes is, even in the choice of therapies, I'm just connecting the thing together. So Dr. Rakesh, when you talked about the typical thing between spasm and stiffness and the way the finger is to move, etc., does it affect the way, let's say, our therapies are being done? Would you now train a person differently? That if I'm a therapist is treating for fibromyalgia, the way the force is applied, the fingers are applied, will be different from typical other, Purva Karma or Pradhana Karma?
Definitely, sir. Definitely. There is a change. So prior to Abhyangam, the trigger point is first done a suppression through Dara, non-contactless treatment, Dara, where the points are just suppressed. Once that is done, to activate the trigger point or to release the taut band, stiffness and things like that, the strokes will be concentrated, the pressure, the which part of the palms, those will be concentrated. Definitely there is a change in normal Abhyangam or normal things, the strokes, what we do, there's a differences in that.
Okay.
Because that can also activate or trigger the trigger points. Because you're just rubbing, the trigger points can be activated, can increase the pain.
Thank you. Yeah. So I just connecting with Dr. Indu this point, because typically we in Ayurveda will say I'm treated Agni Yama and I saw improvement, right? But the number of times the improvement is not there, we are not documenting. So when the differential diagnosis is not complete, maybe the person has an Agni and Yama issue, but when we don't completely document and when we don't get where the impact is not there, we'll say, oh, maybe some other confounding factor. So my question is, doesn't this case actually illustrate the need for very precise clinical examination, differentiation? Dr. Bhatt also said between muscle and bone and joint, all those points came. But how often are we missing this is one of the key lessons, Dr. Deepna, your side is totally quiet. Huh? Yes, Dr. Bhatt. Please go ahead.
The difference between cervical spondylosis and fibromyalgia will be totally different.
Yeah, that's clear.
Yeah, we can.
That's clear. There's no confusion there.
Yeah. Muscles are mostly.
Let's take migraine. Take migraine, right? Take migraine and fibromyalgia will be a
muscle trigger point. Migraine and sternocleidomastoid muscle trigger point.
Migraine comes periodically. And this particular fibromyalgia, which is forehead or anywhere else, may not be such periodical. It may come anytime it may go. This is the thing. For migraine, we can differentiate between the migraine and also this particular thing. And what is the triggering point, that also we have to see. And fibromyalgia, it may not occur only in the this one. It may occur next day. It may occur anywhere in the body.
Okay.
So fibromyalgia may occur anywhere in the body. It is not restricted to only one particular part. So with that, we'll be able to differentiate whether it is migraine, whether it is actually this. Because if it occurs in one particular, it may be migraine, it may be this one. But in fibromyalgia, it may affect other muscles of the body also.
Associated with headache. That's the first hold method. Once the trigger point is reduced, wait for the episode. If the episode is still resistant, then I treat for migraine. Migraine, my first line of treatment is again Amapachana, Pitta Shamana, and then Shrota Shuddhi. That's it. My first line of treatment is common for both. It is common for both myofascial pain syndrome as well as migraine. Common point. But my added treatment would be to reduce the trigger point on my clinical examination, which is on the particular muscles, is what I want to add, sir.
Deepna, Dr. Kalpita. Anything you would like to comment?
Yes, sir. We had a small doubt. Would Agni Karma be any way helpful in the treatment in this?
No. Agni Karma is like an HMPT, like to see that the muscle stiffness is to release the stiffness at that particular time. Acute stage we cannot do. Acute stage we can never do Agni Karma.
No, in the chronic stages of this disease, in the chronic stages, if we could employ Snigdha Agni Karma, would it have any effect, or would that increase the inflammatory process?
That is the reason. Yes. In non-inflammatory phase, that's why Agni Karma is indicated in Gridrasi, because of the muscle involvement. Gridrasi is a nerve involvement as well as muscle involvement. If there is a muscle involvement more, Agni Karma plays a role in the this one. That's a gluteal muscle trigger point complex.
Right.
So once that is the role. It doesn't do anything on the nerve. It doesn't do anything on the nerve, but it releases the muscle spasm. That is why in Gridrasi Chikitsa Sutra, Agni Karma is told. It is that avastha of that disease only Agni Karma is done. In our science, if you, in our language, if you have to say, it is on the health management program is what we'll have to plan the Agni Karma if required. But by Shodhana only it will be controlled. Yeah, Agni Karma if required. Like for example, tennis elbow. Again, it's an avarana condition. Nothing to do with this, but it's an avarana condition. So that time, as a health management program, Agni Karma is indicated. You can't do it stretch. It's just a periodically thing.
So one more doubt, sir. Hello.
Yes, please
Yes,
go
sir.
ahead.
Yes, madam. Yes, madam.
You have suggested Takradara, that is a Shira Ruksha procedure over the head. And how was its impact in the body compared to this condition? And why did you choose Takradara, sir? Is there any preferences why than Kshiradhara and Tailadhara in this particular condition? Basically, we are dealing with a Vata Roga.
No, Pitta involvement is high. Anitrata, Rajo Nivritti was there. Because Rajas was in a very high phase. Pitta
Yes,
involvement is there. Number one. My objective is to reduce the Pitta. Taila I cannot use because of its Ushna Guna. So I have to do on either Kshira or Takra. Kshira is contraindicated because of its Kleda Abhishandi and it can affect the Dhatvagni. I don't want to do that. Takra is Lagu Ruksha. It can flare up the Dhatvagni. My Mamsa Dhatvagni has to be flared up. So Takra was my choice.
Okay, sir. So the Shida Guna of it doesn't have any effect in the body?
No. There my Vata was, I was already controlling the Vayu through my Ahara and through my Aushadas. By that time, by the phase Takradara come, I started Snigdha Prayogas. Snigdha, Guru, Madhura, Brahmana, Aushadas have already started. So my Vata was in control, but I have to reduce the Pitta also through my external therapies. That was my plan.
Okay, sir.
So what would have been great is, when we did this treatment, the fact, these things, in terms of intent, the fact that Agni Deepanam has happened, Amapachanam has happened, Vata is under control, then I did things. That's the Samyak Lakshana. That's where the Samyak Lakshana charts would have been perfect to bring in. Right? For each stage that Samyak Lakshanas are there, would have been really showing how that theory. Now, something has happened, you're putting a theory behind it. With the theory, we should do the Samyak Lakshana charts and show that what I told us happened. I'm just suggesting, then it is absolutely 100%. I think we come to about 1 hour 20 minutes. But yes.
Yeah, I have a doubt about, in fibromyalgia, pain is more than the burning sensation. In burning sensation, Pitta involvement will be more. In myalgia, the Vata involvement may be much more. So in such condition, Vatahara treatment, of course, by Ahara, adjusting the Ahara is okay. But by other, we may have to control the Vata dosha, Shirodhana, as well as we have to do the Basti Karma and also the Aushadha. Vatahara Aushadha is much more important than the Pittahara Chikitsa. What I feel, in my feeling, it is like this.
Right, sir. No, I agree with that. Niruham is required. Niruhana is very much required. I completely agree. This patient was this one that, after 10 days in the hospital stay, it was during that COVID time and all the stuffs. 2021, what we did COVID and start of COVID. So they wanted to go fast to the home. That's the reason he was, wasn't planned. Then it wasn't controlled. So Vasti was on hold. That's the reason Vasti. But plan was on Vasti also was there. Yeah.
But this is a case. But in other cases of fibromyalgia, what we come across and what in our what we do, because Vata is the main dosha which is in not the Kapha. In there is more of burning sensation, but in myalgia we don't see any burning sensation, but we see always pain. So my feeling is actually Vatahara Chikitsa should be the predominant Chikitsa after the Ampachana. This is my feeling, but we do accordingly and we see the good results. Yeah, thank you very much.
There was another fibromyalgia case which was totally different protocol from this. So there I had to do a Kalavasti program starting with Lekana, then Niruhana, then Yapana, and then followed by Brahmana. 4 stages of Vasti I had to do to get a control. proceeded with a Rechana. So this was the phases which I have done in another fibromyalgia case. Started with Lekana, sir. You won't believe I started with Lekana.
Yes.
Then I went for Niruhana, then Yapana, and then Brahmana. Mustadi Rajayapana Vasti was the last Vasti which I had already had given. So in Kalavasti program, in Kalavasti, these were the 4 phases which I had already given. So some cases definitely Vasti is the best in fibromyalgia, but in this case, because of that COVID situation, I stopped there, and then that's the thing.
No, Vasti was given continuously. No, Niruha Vasti.
No. I started with Lekana. Amongst the Kalavasti. Kalavasti program, you have six Kashaya Vastis. First 2 was Lekana, next one was Niruhana, next 2 was Niruhana, one was Yapana, and one was Brahmana.
Anuvasana is included in that?
Yeah.
Anuvasana?
Anuvasana is there. Alternative of Anuvasana. I'm talking about the Kashaya Vasti Krama, which I had to do is this one I was going to say.
Yeah, okay. Fine. Thank you.
Great.
Yes, sir. Thank you, sir.
So before Dr. Abhilash says a vote of thanks from all of us for a very stimulating discussion. I think this will definitely set the benchmark for the next one, and I hope that next week's team also comes up with something very solid done. And my compliments to Dr. Rakesh and team CMI. Keep up the good work, right? And let's go further. There are some areas for tightening. I think we are good. Yeah. Over to you, Dr. Abhilash.
Thank you, Dr. Rakesh, for a wonderful session where you throwed your light and we learned about how the integrated approach should be in understanding the anatomy, the neurophysiology of this case, along with the Ayurveda Roga Samprapti. And with an importance which was given for the differential diagnosis to draw out the Chitulsa Siddhanta. I think that is the some of the key learning points of this session. And so thank you, Dr. Rakesh, and all the panel members who participated and all the participants. Once again, we will meet next week, again, same day, same time. Thank you.